He's not very quick today. Okay. Thank you, Mr. Chair. Here we go again. I have an amendment at the desk. Ask unanimous consent that the reading of the amendment be dispensed
Without
with.
objection, the reading of the
Okay.
amendment is
This is
dispensed.
really a my.
You'll let me
Over on top of the my. Oh, so sorry, Mr. Chair.
Just let me quickly run through the technicalities. Without objection, the reading of the amendment is dispensed with. The gentlelady is recognized to make remarks on her amendment.
Thank you, Mr. Chair. I appreciate that. All right. The obsession with inserting anti-abortion policies into healthcare is on steroids in this bill. So let's be clear about my amendment. This is about improving healthcare by stopping political ideology from controlling healthcare. It's about protecting patients, trusting doctors, supporting science, and making sure that medical decisions are guided by medicine, not an agenda overriding science. My amendment is simple, and it's life-saving. It removes dangerous provisions that threaten medical research, medical training, and the ability of patients to get the care they need. They have put politicians in the middle of the most personal and complicated decisions a woman can face. And this is why we call them poison pills, because they're going to make people sicker, especially women. Pregnancy is more dangerous and take away the care that families depend on. And this is what happens when government substitutes and replaces medical judgment. It's not healthcare, it's politics. Now, one deadly rider, listen to this, one deadly rider attacks life-saving medical research, the kind of science that gives families hope when they receive a devastating diagnosis. Research that helped us lead to medical breakthroughs including vaccines and advances in cancer and HIV, Alzheimer's, diabetes, and pregnancy complications. Another rider, another one of these poison pills, interferes with medical training, making it harder for future OBGYNs to learn how to respond to miscarriages, pregnancy complications, and emergencies. Another blocks funding for Planned Parenthood health centers, trusted providers that millions of Americans rely on for cancer screenings, birth control, and preventative care. And another, we'll keep going, another prevents doctors from giving patients full information about their reproductive health options. And another poison pill opens the door to lawsuits against states and communities trying to protect access to care, putting a provider's refusal ahead of a patient's need. Now, some of my colleagues, they might say these provisions, these poison pills protect life. I say protecting life means protecting the health and safety of women carrying life. It means valuing the mother, her health, her future, her family. It means trusting women, mothers, families, and doctors to make the most personal and difficult medical decisions. I urge my colleagues to support this amendment so we can get back to a bill that this should be about, right? And helping people live healthier lives, not pushing a political agenda. Support this amendment. I yield back.
Thanks, gentlelady, for amendment. Gentleman from Alabama.